are going to be covering how to add an event code on the flow tracking window of the patient flow tracking window. For that, we need to use inter-EPOMIS. I know the medical assistant always use inter-EHR, but for telemedicine visits, if you're going to have a provider that on the appointment list, that provider have some telemedicine or telehealth visit, the best practice is to enter first into inter-EPOMIS. Do not enter first into inter-EHR. I will explain why. The reason I recommend to enter first into inter-EPOMIS and not into inter-EHR is because from inter-EPOMIS you have the ability to access inter-EHR. If you click here on clinical, the last of the options on that menu that appears is an access to inter-EHR. So you can enter into EHR from POMIS, but you don't have any option here to access POMIS. So if you open inter-EHR first, you will need to go again to Citrix and access inter-EPOMIS from the outside. You are going to use this blue man with the clock, okay? The blue man with the clock is the patient check-in or patient flow tracking. If you click there, that will open this window, the patient flow tracking window. From there, you are going to search for your provider. I will work with Alexander, this patient here. Let's say I already called Alexander and Alexander answered the phone. So at the same time, I have my inter-EPOMIS open. Remember, you will need to click on the blue man with the clock. That will open this window. Maybe you already have this window open with your provider here. If no, you need to select the provider, remember, and look into the provider list for the patient you are speaking with. So I will do double click over Alexander. That will open my record event code window. If you see here, almost everything is already filled. The only box we need to fill is this event code. The faster way to do that is to press, on the case of telehealth visit that you are going to be adding this code, is to press S on the keyboard, okay? S for sign in. After you enter that code, you will see that the event code is already documented here or record here. And if we return to the EHR, right now we are not seeing nothing here because the system has a 3 minutes delay. So the system refresh every 3 minutes. But if you want to refresh faster than that, just press on the keyboard F5. And now we have the event that we added here on the patient flow tracking window on POMIS. Okay. After you enter the sign in, you can return to EHR, click here and enter vitals. That is the first status you are going to use into EHR as a medical assistant.